Talking about feet and the importance of foot exams, that is my passion. And I know it's kind of funny whenever I say that, a lot of people kind of go, ew. But that's okay because I get it, feet can be really gross. But feet are also, we take them for granted. For example, we can go from point A to point B, and we don't have to pay for gas, and we don't have to pay for an Uber. And in Montana, where I'm from, feet allow me to enjoy the mountains and rivers on the Crow Indian Reservation. But feet also can tell a story. Let's say you're playing poker, and if you suspect somebody is bluffing, pay attention to their feet, because sudden movement can often indicate their anxiety. Say you're attracted to somebody. Your feet are going to point at them, and they'll point at you, and there's a chance you might make a love connection. But let's say feet. Feet can tell us a lot about our health. Feet can sometimes have swelling and discoloration, which can signal arterial and heart disease. The bottom pictures show calluses and dry skin, which can indicate diabetes. But when these conditions are not treated, they can often lead to patients losing their limbs and their lives. So in 2015, Dr. Mark Krieger cited the historical medical manuscripts of the ancient Greek physician Hippocrates. Hippocrates wrote, "Vessels, they're like rivers that purl through the body, supplying life and beauty to everything it touches." This metaphor is very descriptive of the Wyoming's Grand Teton National Park. This river supplies life and beauty to everything it touches. But what happens when a river becomes obstructed or damaged? The ecosystem below it starts to die because the source of nourishment and protection is gone. And this similar phenomenon is what occurs in the vessels of our veterans. So how did I become somebody who loves talking about feet? Well, my journey began in 2006. I graduated from nursing school, and I started my career at the local county hospital before taking a position with the Vascular and general surgery team. It was at this job where I was introduced to diseases of the lower extremities. I remember the first patient I saw, he came in and he had a left leg infection, and it started from a diabetic foot ulcer. We had to do surgery on him, and I asked if I could assist with the pathology report. So I went in, and when they removed the leg, I remember I was shocked at what I found, because I remember the artery that we took out of the leg, it was distorted and it was discolored. And when I looked inside the vessel, there was no blood flow, or just very minimal blood flow to the tissues. The muscle looked malnourished. It was brown and it was pale red. And I remember the bone where the infection was localized, I could push my thumb on it and the bone disintegrated. And we continued to see patients like this over the course of the years, but I started to notice a pattern that many of them were veterans. So in 2014, I transitioned to the VA, where I took a position as the primary care nurse. I remember the foot care nurse at the time, she comes running into the clinic and she's like, "Lena, help me. This man's foot is about to fall off." I remember I go running in there, and this is where I first met a veteran whom he was very angry. I'm gonna call him Bill. He did not trust the VA, and he had not sought health care for years. And when I looked at his foot from the toes to the midfoot, it was black. And then both of his legs, they were red, they were swollen, and we immediately got him transferred to a higher level facility of care where he underwent a left foot amputation as well as having to have blood flow restored to both of his legs. So he was hospitalized for several weeks, and once we got him back, I had orders for wound care for twice a week. So the first time he comes, he's still visibly angry, and he tells me, "Don't preach to me about my diet, my diabetes, or my smoking." I'm like, all right. But the whole time I'm doing wound care, he's patronizing me, and he's talking horribly about the VA, and I can tell you I could not get out of there fast enough. So I just wanted to do the basic care, and I was good with that, and just get out. But the fourth week arrived, and Bill was a little bit different, and he says to me, would Diet Mountain Dew be better than this? And he's holding up one of those liters of orange Shasta. And I knew he had just given me permission to help him. And I didn't want to give him a fire hose of information to bombard him, because as nurses, we love to do that. We love to give you so much information. But I gave him one topic at a time to just think about and ponder. And I did that for several weeks, and the 10th week arrived, and his wounds were healed, and so I was transitioning his care plan to less frequency. And I noticed as I was doing that, he was distracted. And I asked him, I said, Bill, are you okay? And he looks at me and he says, can I tell you a story? Bill had joined the Army following high school graduation, and it was during the Vietnam War. His father had served, and he wanted to serve as well. Bill kind of had a preconceived notion of what Vietnam would be like, but once he got there, and these are his words, he said he had gone straight to hell. You know, he would go out, and every day he'd be bringing back somebody's body, or he'd be bringing back what was left of their body. And every day that he went out on patrol, he was terrified. And he just wanted to get home. He was just a kid, and he still wanted to get back home alive. But over the course of the several months, some mongrel dogs started showing up in the camp. And Bill and some of the men started befriending these dogs and feeding them food morsels. And this puppy started following Bill around. And every day after his patrol, she'd be there waiting for him. And she reminded him of his dog back home. And their bond grew, like we do with most of our pets. And she was more than a friend. She wasn't just a mutt. She was his companion, but she was also that source of comfort and peace of home that he needed. But one day, the unit leader orders the men, says, I need you to meet me out in this field, and you bring your dogs. So he's a little puzzled, and so he makes a makeshift collar, brings his dog, and he goes out to the field with the other men. And as soon as they get there, the unit leader starts reprimanding the men. He reprimands them because they're becoming too soft. They're developing attachments, and he orders them to shoot their dogs. Bill immediately, he's shocked, but he has no choice in the matter. And he shoots and he kills his pup. Bill starts telling me the story, and the more he talks about, he's sobbing in my office. And he talks about how Vietnam robbed him of his life and robbed him of his youth. And he started to just hate himself and hate everything that he had done. And I can tell you that night I was driving home, and all I could think about was Bill and his story. And normally when I get in my car, I shut the door, turn up the music, and I am Beyonce. But not that night. I was quiet. And as I was thinking about Bill's story, I was forced to reckon with a realization. And it was the fact of the care I had provided Bill. And I recognized that I was stigmatizing Bill for his mental health disorders, and it's a prevalent problem in healthcare culture. And when I realized that, I was sick to my stomach, because not only had I violated the VA mission of care, I had violated the nursing code of ethics. And I remember that night I was laying in bed, and I was just crying in bed quietly. And I prayed, God, please help me to do better. Please help me to find a way to serve our veterans. And I also wanted to find a way how I could help Bill. So over the next several months, Bill continued to see me, and I saw him in clinic 2 to 3 times a month, because even though his wounds had healed, he was still not out of the woods. But because of my vascular training, I was able to detect subtle changes that could develop into a foot ulcer. So every time I saw Bill, we would talk about it, and he started to feel valued. And in turn, he started to take care of himself and seek out care for himself and take ownership. Every time he saw a VA provider in the community, and every time he accepted a new service, we celebrated. And every time he attempted again to quit smoking, he was encouraged. And every time he didn't have a foot ulcer, we celebrated. But the celebrations did not last that long, because in less than a year, Bill passed away from a massive heart attack. And my heart broke. And I remember just thinking, this was all for nothing. But Bill's fight became my fight for our veterans, because I started to delve more and to try to understand how Bill's life could have had a better outcome. And I was introduced to Dr. Aaron Armstrong, one of the nation's leading researchers in cardiovascular disease. And he showed me the desperate need that we have to start doing better foot screening and better foot care. And I started to learn more about military culture and exposures that our veterans face during service. And Bill was exposed to Agent Orange, which is a presumed cause of diabetes, and it also increases in amputation risk. And the more I learned, the more I realized this is a crisis, because our veterans are still fighting a war, but it's in their bodies, and for many of them, they're losing. And having Bill as my patient was providence, because it helped to open my eyes to not only the seriousness of amputation, but it helped me to show how I could make a difference. I could use my skills that I had learned, my vascular experience, to be a foot care advocate, and also to advocate for better foot care at my facility. So according to the CDC, 45 to 85% of amputations can be prevented with a comprehensive foot care program. Our veterans have some of the highest risk factors for an amputation, but yet oftentimes foot exams are overlooked. And for those patients who do have an amputation, they have a mortality rate, or I'm going to say a death rate, as high as 5 years or less. Bill was gone in less than 1 year. And the reason for these higher than average mortality risk is due to an underlying cardiovascular disease that's often undetected and unrecognized. This fact is why we have to do a better job with screening programs such as vascular screening, so we can encourage better outcomes in patients. Thankfully, the prevention of amputation in veterans everywhere, we also call it the PAVE initiative. They're tackling this crisis with VA-led research and innovations. The first slide to the left is Ampticide, which is currently being implemented at VA Puget Sound. This tool can identify patients at risk for an amputation. And to the right is remote temperature monitoring foot pads, which can identify the early development of diabetic foot ulcers, which again lead to amputation. The VA since 2018 has been decreasing amputation rates, but even with all our innovations and all our research, we're still having too many, and there's more work to be done. Dr. Jeffrey Robbins, who's the National Director for PAVE, he states it clearly: any amputation is a tragedy, and we strive to do even better. So in closing, I'm going to share the story of the grateful starfish. This man, he's walking along a beach, and he notices this boy in the distance. And so he gets closer, and he sees that this boy is throwing, it looks like starfish back in the sea. And the boy happens to see him, and he says, if I don't get these starfish back in the water, they're going to die when the sun comes up. And the man, he's perplexed. He's like, there are thousands of starfish, and there is miles of beach. There's no way you can make a difference. It just doesn't matter. It doesn't matter how many you put in. But the boy, he picks up that starfish and he puts it in the water and he says, it matters to this one. Every one of us within the VA, it doesn't matter what role we play here, every one of us can make a difference with our unique skills and abilities that we have. We can be the sea, we can be the river, and we can be that boy standing on the beach. Because what we do here at the VA, it matters, but I can also tell you what we are not doing at the VA, it matters as well. Bill, for me, was my starfish, and his life mattered. And he is the reason I'm standing here today. Because you know why he showed me? He helped me discover how I could use my skills and my abilities so I could serve and make a difference. And what I discovered was this, that when I do a foot exam, I can do so much more than just plain old routine foot care. Thank you.